So really useful, Phil, to help us demystify artificial intelligence, make us realize that it's actually not as hard as some of us think. Phil is with us for the day, so if you're in the AI and technology for good vertical, or at the end of the day, he's going to walk us through how to learn machine learning very fast. So stay tuned if you want to chat more with Phil. But for now, we're going to move on. We want to take a look at some very interesting new AI applications. For this session, it's our great honor to have with us today Charles Bark. Now, Charles is actually based in Shanghai and has traveled to Singapore today to be with us, so thanks a lot, Charles. Greatly appreciated. Charles is the founder and CEO of HiNounou, if I'm saying it correctly, I believe so. And that is a fast-rising AI and blockchain startup that actually helps elderly people live longer, healthier, and happier lives. In 2018, in January, he was named by French President Emmanuel Macron as one of the top 3 French entrepreneurs in AI in China. So a great honor, and terrific that France is getting involved in recognizing great new technologies. So Charles, it's my great pleasure to welcome you to the stage. Thank you.
Thank you. Here is better. Thank you for this privilege and honor to be with you this morning. With you, I'm very happy and honored. Thanks for INSEAD to invite me this morning. Everybody, when we came this morning, we saw on the front door this title, Power for Good. Thank you. It was just to check if you were sleeping or not. Now the question is, how is it possible that AI be a force for good when we mix AI with a vision and to help seniors in Aging Concept 4.0 to be a game changer in the world and help the seniors to live longer, but not longer only, healthier, happier at home. It is a result of 12 years R&D in 4 countries in the world, and I'm happy now to deliver what we achieved. I forget this. Yes. It will be better. Before starting, I want to ask you one question. How many of you, raise the hand, live like me, far away from the elderly parents? Not close, but far away. Yeah, it's at least half of the audience today. And this is exactly my case. If you see this lady, did you saw this lady before? No, because it's my mom. So this vision of helping the seniors to live longer, healthier, happier at home came from my mom. She's a retired doctor. I'm a 3rd generation working in healthcare. And the matter of fact is, when I was living in Shanghai, she was living outside China, and 6 years ago I called her and I said, "Hey, ma'am, how are you doing?" She said, "Yes, I'm fine, don't worry." But then my older brother called me and said, no, she's not fine, she just fell down, she went to hospital. Then I had a shock, and I said, wow, I realized that I was blind. I didn't have any visibility of health at home. And then my fear was, what will be the next call? I didn't want to rush at the last time and see like a fireman that he was already ashes. So the big question was, how is it possible to take care of our elderly parents when we live far away from them? Is there a way to use the best of technology to solve this mega issue? And having been raised in France, born in Paris, but with an Asian family, I was born in this concept of yin-yang. Don't oppose 2 concepts. So we took the healthcare mindset of the Westerners, which is post-accident and treatment, mingle in a yin and yang way with the traditional Chinese medicine way, which is very oriented toward the preventive. And the question and the challenge was, how do we mix together with the AI? Because this problem of aging is a very, very big and the biggest silver tsunami bombing that will hit all the countries in the world. And the question is how AI can be solving this issue. But before that, before going to the problem solving, let's focus on the problem itself. Where I live, we have today 200 million seniors. What is a senior is above 60 years old. The classification of World Health Organization will define three kinds of categories about seniors. First one is healthy aging, 60 but healthy. Then we go to the second classification, which is fragile with multiple chronic diseases. And then the third one will be dependent. We are focusing in our solution in the category 1 and the category 2. How is it possible to keep them healthier? And the second one, those who are fragile, how is it possible to reduce the risk of the chronic diseases? So when we look at the figures of the seniors, 200 million, 30 years from now, there will be 500 million. Almost half of the population in China will be seniors. Among them, today, already 60% are living alone. And one-child policy means one child taking care of 6 people. So there is a very big economic burden because out of the pocket in China, this is a 50%. And then when we think of the senior caregivers today, senior caregivers, you have already a lack of 10 million. So what will be the figure when the population will be half seniors? That is a big question that we must think about AI. The second thing is, when we think of the life expectancy of Chinese people, 75 years old, the most important figures is not the life expectancy, but the healthy life expectancy, which stops at 68. So from 68 down to 75, you have 7 years turbulences. And the major issue is within these 7 years, nobody wants to insure those seniors because of the heavy risk. You have the national security, but no private insurance. And the value proposition that HiNounou brings is exactly within these 7 years turbulences. How is it possible to use AI in an ethical way to bring a service that does not exist today for those 200 million? If you think in Singapore, Singapore will be almost the same. Today we have 1 out of 6 seniors, and within few years it will be half, exactly like in China. And if you look at this, you may think of what is the problem from 2008 to 2018 when you look at this evolution of the age pyramids. You can see here, AI cannot be a problem solving from everything. AI can be a problem on the top of the pyramid because you have a massive elderly and growing. But if you look at the other problem in many countries, like the fertility rate is going down and down. And the problem of fertility is not something that AI can do something. The only way to increase the fertility rate to 2 child per family is maybe what we call blue pills or Viagra. But AI can be very beneficial from the top of the pyramid. When you have a growing number of elderlies, the question is how AI can reduce the chronic diseases and how can it affect the people in their change behavior. The key success, and we will, from now, we will start to think about the solution. Now we have a clear vision of the problem. Let's go now to the solution and see what are the main positive key success factors if we want to implement and use AI to solve those problems. Number one, like a professor was saying before, AI is created by human to serve human. That means all kind of relative AI should be human-centric, definitely, and not digital-centric. That should be the good direction. And in our concept of aging 4.0, we put the seniors at the center. Focus on the seniors and their family. Then we have 3 other components. we take them at home and turn around this home into a smart home with different kind of IoTs, medtech. Then after that, when we collect the data on the cloud, then we use an AI preventative platform to reduce the risk of chronic diseases. And then after, we bring an ecosystem where different partners can hook to this hub and bring their own value proposition centric to the elderly. The second key things takeaway for the AI project is it should be also user-centric. User-centric and always think as a benefit for the target customer that we're looking for. This is, by the way, we are in the business school, one of the best in the world, and we can apply exactly the basics of doing business, making money, exactly with the AI. We should always think of the benefits of the users. So in our case, the clear value proposition was how is it possible to help the seniors to live longer, healthier, happier at home, but also a ripple effect with their children, like me or you living far away, is bring the peace of mind to their children. And then the third takeaway for the AI project is about the data, because AI means nothing if you have five data. But if we have 5 billion data, that means something. And we can run the engine, we can call it coding or algorithm or whatever we call it, but then we need a big data. And once we have said that, the question is how do we collect those data? Those data should be cross-border. The more it is cross-boarding different disciplinary, the more it is holistic approach, the better will be the diversity of the analysis that we take from those data. So of course, we can think of security, we can think of accuracy of those data, especially on health, and we also need to think about the privacy, and overall, we have to think about ethical use of those data. So in our case, how do we use this cross-border data in a platform type? We start, you see in the number 1, you start with the risk evaluation. Risk evaluation is very important because from the risk evaluation done with the DNA testing, we partner with the biggest DNA testing in China, that we deliver this DNA testing that assess the top 10 risks of the seniors. Then we go to the health monitoring with different kind of IoTs, medtech. We analyze those data to alert the caregivers. Then we provide a third component, which is protection. So we have a box, and I bring the box here. And you find all-in-one solution in one box that we sell today. So in that box, you find, like you see on the picture, a DNA testing. You find also a dedicated mobile phone for seniors, and we partner with the third telco Chinese called ZTE, who has a dedicated mobile phone for seniors, and we have a different kind of IoTs medtech. And then the question is also protection. So we partner with the number 1 insurance in the world called AXA, who deliver the telemedicine. They press a button and they have a telemedicine 24/7 at home. And the question is, what happens if they fall down? We partner with the number 1 Chinese called Ping An, who deliver accidental and death up to 100 years old. And you remember, after 70, it was not possible. Today it's possible, up to 100 years old without underwriting. And we also prepared during 4 years another innovation, which is a robot service companion that can also enhance the socialization, because we have to think about the social aspect. In terms of the platform, we have a blockchain platform that brings the data ownership to the seniors. This is very important. And we built on the blockchain platform this utility token that reward the seniors when they gave us that data. We have also this LifeCare ecosystem when different players can connect to this ecosystem and use those data to bring a better service to the seniors. So now, I want this slide is especially for those of you who are in AI project or want to develop this business. The question is how HiNounou, a startup, you see my challenge, if you put yourself in my shoes, the challenge is we need the big data, but we are small, we are startups. So how is it possible to collect as much as possible data from a big customer base? I believe in this trio, startups need to partner with either big corporate as well as government, like this kind of PPP, private-public partnership. And how did we achieve to get this partnership at A-class level to help us to analyze and be hooked with different cross-border data? The only way to achieve that in our small scale was to go to any kind of worldwide contest. And we were very happy to compete with the best in the world in whatever discipline we can find to be able to win. And then when we won those contests, we were able to be hooked with those corporates. And so what we did is we started in 2017. After those all R&D, there is a buyer who is one of the most innovative pharma labs in the world who did this innovative contest called Grant for Apps, and we won that for all China as the best healthcare digital startups. Then Intel, we were classified as a top 10 AI startup in whole China. Then also in 2019, recently, we were applying with the biggest and the largest platform accelerator for startups in the Silicon Valley called Plug and Play. And we were admitted in Singapore batch as well as Beijing, and then the accelerators in those continents. And at the end, as the professor said, the president, when he came to China, he has in his agenda to help Xi Jinping to solve this aging issue. And that's why he came, and I was privileged to have a 30-minute meeting with his cabinet to see how we can collaborate with the government. And since that, you saw here the research minister. She helped me to be hooked with the president of the French Academy of Science called CNRS. And with CNRS now, we are bringing the best of innovation from the national researcher in this box in terms of early detection of chronic diseases and cancer, and bring this innovation in the box to get a better traction and benefits to the seniors. My conclusion is AI and health has a great future. Key indicators is the FDA. 2017, there were only 2 AI algorithms that were FDA approved. 2018, once a month. And 2019, you name it, there will be much more. In China, it's a $150 billion business. And if we think of the aging, because there is not any relevant services with AI, that will be a major game changer. So my conclusion is AI is only pertinent if we have a humanistic vision. If we use these resources of technology as well as our heart to bring a better life to the people who help us a lot, and by the way, if we are here today, it's because our parents sacrificed to bring us here, we have to use our privilege today to return back, not only to our parents, to the society. So let's turn silver to gold. If you want more detail, welcome to our panel discussion with a wonderful speaker this afternoon that will bring their vision about pharma, government, and also editors from Microsoft. And then we will see how is it possible to leverage a better understanding. And at the end, live your dream as an entrepreneur. As long as you live your dream with AI or without AI, you will be always happy to be a game changer in the world. Thank you.
Thank you very much.
Thank you.
What a terrific example of a startup using AI to have a tremendous impact, obviously through partnerships and a great way to get the data and actually make the delivery. So wonderful example, really doing some good. Let's take some time for questions, because I know that this arena is one where AI could have a lot of opportunity. Could we get the mic over here?
Thank you for that presentation. I work in the same space, so I've got some questions. Curious what you've learned and what have been the outcomes to your customer base?
The first part of the question was based on what I learned.
What have you learned so far in
Okay.
implementing the program?
The learning, thank you for your question. The learning was very consolidating. The first value of AI was we should be human-centric. The more we are digital and talk about AI, whatever, IoT, whatever, the people are little by little giving up. So the more we are driven with this kind of humanistic vision, but instead of non-existent solution, we bring the best of technology and we help them to understand the benefit of this, which is, for example, helping you to live longer. If you have a chronic diseases, we reduce the risk with the analysis of the data. And from the raw data, we convert that into knowledge that will help you to change your behavior, nutrition, fitness. Then the key learning was quality of the service will bring conversion of change management. And this only be done with a humanistic approach. The more we are driven with AI, data, whatever, we lose the people, especially the seniors. So it's kind of yin and yang together. But we should be careful of the way we communicate.
And the second part of the question was the outcomes you've observed.
So outcome, today we are working with some insurance, and the insurance want to reduce by 60% their premium, especially on diabetics. Today, insurance don't want to insure this kind of chronic diseases person, and now they turn into what we call dynamic pricing. You use this kind of preventative way to reduce the risk, and if you really change your behavior, we lower down by 60% your premium, and that will be the trend of InsurTech positioning.
And have you seen the health of the base improved, or is it still early on to observe that?
Do I see the?
Have you seen the health improved?
Yes, definitely.
And I guess,
Definitely.
yeah.
You cannot, depend on what we're talking. If we're talking of diabetics type 2, we cannot like revert completely, depend on the level of diabetes where they are. But instead of going down like that, we can kind of facilitate their life and not to have this kind of throw doors back.
Can we get maybe one more question? Anyone else have a question?
Hi, thank you for your presentation. I noticed that the first step for this startup is to collect the DNA information from the customers. And there's increasing concerns about...
Speak up.
Sorry. I think the first step is to collect the DNA information from all the patients, and there's this increasing concern about the information security, especially when people can now link a few distant relatives' DNA and then pretty accurately predict what's your DNA. So in terms of this particular aspect, is there any measures to guard against any information leak that is so crucial to a person's identity?
Is there some, sorry? Can you repeat the last part of your question?
Is there any protections against this crucial personal DNA information?
Privacy issue.
You mean privacy or security, which is different? Or both?
Because through the partnership and the network,
Yes.
The information may be shared, but DNA information for a particular person is so critical.
Okay.
Yeah,
I
Just a
got
question.
your point. Thank you. Number one is the security, what you're talking. We believe that, and you had a sad experience here with Sing Health, where there were being like 1 million plus data has been hacked. So we believe that from the multiple examples in the world, centralized database are kind of weak in terms of security. That's why we turn into this kind of blockchain distribution and difficult to hack in some way. But we believe from our experience that a full blockchain system is not workable also because we have other weaknesses on the blockchain. That's why for the security, we do kind of a hybrid model between the cloud and we store the hash of the ledgers on our system. So to answer your question, distributive model on a blockchain platform. And regarding the privacy, which is also another key issue, we believe that ownership should be given to the seniors. And then, because they can look at what we're doing on this distributed model, which is the blockchain, we cannot do something without them knowing that. And we cannot do some monkey business backward. So that is also the benefit for the ownership and also the usage of blockchain for that.
Thank you.
Thank you so much, Charles. That's great.